Have you ever seen someone suddenly struggling to breathe? Let's talk about an asthma attack and what we as medical pros have to do about it. So, first things first, we got to actually be able to spot the asthma attack. What are you going to see in these patients? Well, they're going to be tripoding. So, they're going to be leaning over, kind of hunched with their hands on their knees, just trying to breathe, right? That classic I need to take a deep breath sign. The next thing you're going to see is, of course, dyspnea, which is just difficulty breathing. You're going to be hearing expiratory wheezes. Typically, they can be inspiratory, but usually it's an expiratory wheeze. And then this difficulty making sentences, right? Sometimes they can only get out 1 to 2 words. If you start seeing this like shortened sentences kind of talking, you know it's starting to get really serious. So be very careful. What are the typical treatments that go along with an asthma attack? Well, you're going to have the classic duoneb, right? Albuterol and Atrovent put together is going to really help open up those airways. Albuterol is going to be your best friend whenever you have wheezes or bronchospasm, anything of that nature. Now, going along with that, if you have a severe asthma attack, you're also going to start giving things like mag sulfate to really relax the muscles. And then also you can start considering something like a corticosteroid to really help with inflammation and all that. Here's a pro tip and something you have to remember. If you're not hearing lung sounds, that doesn't necessarily mean that they're not having an asthma attack. They could be having what's called a silent chest, right? So if they're wheezing and asthma has gotten so bad to where their airways closing up and you can barely hear any breath sounds, that's really, really concerning. You should be calling for all the help in the world if you start hearing a silent chest. And in a nutshell, that's an asthma attack. If you feel a little bit more confident seeing and treating asthma, please give me a like and follow for more tips that you'll actually use at the bedside. Y'all have a great day.